Thank you very much. So here's an update on the coronavirus epidemic. Our daily case counts have been steady in the past week, which is generally good news because we were at new lows last week. Here are the numbers. Since this time yesterday, we've identified 76 cases of the coronavirus infection, bringing us to a total of 35,901 since the beginning of the epidemic. Now, for the past week that ended last Saturday, September 19th, by the date in which the test was run in the laboratory, we averaged 80 cases per day. And of those who were tested, 2.5% were positive. Those numbers are similar to the week before, where we had 71 cases per day and 2.8% positive. And that was the lowest that we'd had since the first week of the epidemic. Now, the lower percentage positivity last week, but the increase in cases is because we had more testing done last week than we did the week before. Overall, about 50% of our cases in the past few days have been either in the 10 to 19 age group or the 20 to 29 age group. And that's reflecting the impact of the college outbreaks we're seeing here in the city. And that's these college outbreaks are occurring all over the country. Now, the colleges have been open 3 or 4 weeks, and overall, the number of cases in colleges has not increased over the past couple of weeks. Schools have also been open, and at least some schools have been open in Philadelphia over the same time period. And good news is that we are not seeing any clusters so far in K-12 schools that have been open during the past 3 to 4 weeks. We are seeing isolated cases in students as well as in staff of those schools, but those are likely people who bring it into the school. We have no evidence yet of any spread within schools. Since this time yesterday, we've identified 2 new deaths from the coronavirus, bringing us to a total of 1,787 since the beginning of the epidemic. Just a reminder that our data on deaths often comes in batches. We average about 1 per day, though. That's what's happening in Philadelphia. Of course, the rest of the state of Pennsylvania and across the United States, unfortunately, case rates are now rising. And that's due primarily to college outbreaks that are occurring across the state and across the nation. At the same time, if you go to Europe, in some countries, they're seeing a surge in cases, which was worse than the wave that they had last spring. And in fact, several countries are now reimposing restrictions that they had first imposed last spring that they have rescinded. A lesson here is that we shouldn't be lulled into complacency about the falling case rates here. This virus clearly has the potential to come back strong. And the best tool we have right now to combat the virus is masks. I'm going to come back to that in a minute. Just an update on testing. We continue to put more information on our website tool where people can search to find testing sites. It's www.phila.gov/testing. You go in there, you can see a map, you can see the locations and schedules for all the sites that offer testing. You can also see the criteria they have, so what you need to meet in order to be tested, whether you need an appointment, whether you can drive through, whether you can walk up, and whether they test children. So lots of information there on how you can get tested. At the same time now, rapid testing is becoming increasingly available through healthcare providers across the city. Because of that, we issued guidance yesterday to doctors about how to use and how to interpret the results of these rapid tests. The main messages to doctors are this, that these tests are good that they're rapid, but they can have false negative results or false positive results. The likelihood that a result is a false negative or false positive really depends on the situation of the person that's being tested at the time. And doctors may need to do a standard test, what's called a PCR test, at the same time to confirm a result to make sure that it's an accurate result. The other message we have to doctors is that if anybody's doing these tests with a rapid test machine, they need to come up with a mechanism to report the results to the health department. We have ways to get results from the standard PCR tests from laboratories that are well developed. We don't have reporting from clinics on these rapid tests. We want those rapid tests reported to the health department so that we can have data to track the epidemic. As you can see, tracking the epidemic and its progress really influences everything that we do in our overall strategy. Just an update on contact tracing. We're continuing, as with other weeks, to report our weekly statistics. We'll be doing that on Thursday. But here's what we're learning from our interviews, that the most common source for exposure for people with this infection is another household member. And the second and third most common sources of exposures are social gatherings, often typically very small social gatherings, and then people visiting other households, which is typically relatives or close friends. One thing that's important that's coming out this is that workplaces are not a common source of exposure. People are, for the most part, being exposed by their relatives or by their friends. Now, we're going to be posting case studies from our interviews to illustrate to people how this virus is spreading. Often just telling a story can give people a picture that numbers itself won't. Those case studies, we're going to remove the identifiers so people won't know who's involved, and we're going to change the names. We're posting our first case study today. It's an example of where an initial person was exposed to the virus at a religious service. And then over the next 2 weeks, this virus spread through 4 different households. This household all had people who were related to each other, and they were visiting back and forth across those different households. In total, there were 15 people who lived in those 4 different households. 9 of them became infected. So the message here is that if you have the infection, you go truly into isolation, away from household members so you don't spread it to the people that you are closest to and that you care about the most. And if you're exposed, you should truly go into quarantine away from household members. And for everyone else, you should wear masks even when you're around your relatives and close friends that are not living in your household. Then just a reminder on how to use masks. I talked about this last week. We put out a flyer about how to use masks because you want to make sure you're using it well in order to prevent the spread to you or from you. So with those masks, you need to have a good seal along the bridge of your nose, your cheeks, and around your chin. And that can be achieved through a flexible metal stay that wraps around your nose or an elastic so that it can be pulled tight across your cheeks. You want to have the stretchy ear loops so the mask can be pulled tight to your face. You shouldn't be wearing bandanas or masks that are loose below the mouth. That way, respiratory droplets can go in and go out. You should not be wearing masks that have valves in them. Those are used in construction. They're not going to be preventive for COVID-19. And how to wear masks? Very simple. It should cover your mouth and your nose. It doesn't do a full benefit of prevention if it's only covering your mouth. And don't pull it down to talk to the person next to you. That's just the most important time for you to be wearing your mask. When should you wear a mask? Whenever you're indoors with people other than your household members, and whenever you're outdoors within 6 feet of people who are not your household members. Much of the progress we've made in the epidemic is because people are increasingly wearing masks. That's a very good thing. But we're going to need to keep this up, especially as the weather gets colder, people are spending more time inside. So get used to wearing these masks regularly now and get used to wearing them correctly now. More information is on our website, www.phila.gov/COVID. Thanks.
So end of July, I covered a presser where you shared some testing statistics and you talked about southern states opening too recklessly. And you said in conclusion, the second wave of the coronavirus has hit Philadelphia. And at the time, I was skeptical of your claim because when I calculated the percent change of testing and positive cases, it was the same. So 47% increase in testing, 47% increase in positive cases, which seemed to me like, over those past few weeks before that announcement that the virus situation hadn't really changed. And you also said that you explained that the virus started in New York, moved down through Philly and hit the southern states as they were opening too recklessly. And now it's traveled back up and reached us here in Philly as the second wave. At the time, I couldn't find any evidence for that, like any trade winds of like Philadelphians going to Florida or I don't know, wherever was Arizona at the time. So my question to you is now it's been like a month and change since you announced that the second wave had arrived. And knowing what we know now, you have another month of data, you know how it all played out. Do you think I was right to be skeptical, or were we in fact in a second wave? And can you kind of fill me in on how that played out, what evidence you have for it? Is there any more, now that the contact tracers have been going for a while, is there any more evidence to your southern theory of, these states opened too recklessly and pushed a wave back up towards us? Basically, do you still think that announcement was responsible and scientifically sound?
Well, I definitely called it wrong because I said that the case rates were likely to rise, and they didn't rise, that they fell. I have some comfort that I wasn't the only one. There were people who were running mathematical models that said the same thing. The issue was that there was a big wave that occurred in the South at that time. And, was that wave going to arrive here and have our case rates rise further? Or was it, if it started to fall in the South, would it stay the same here? I expected it would arrive here and case rates would rise, but it didn't. So I called it wrong. Since then, I've been more careful about trying not to predict the future. I think the virus is very difficult to predict. I can't say for sure what's going to happen from here, whether we're going to have, when the weather gets cold, an increase. I can say that most respiratory viruses, they do get worse in the winter, but I can't say that. I can't say what's going to happen between now and then.
Do you think, so at the time, what was kind of bothering me about this, one, because I didn't understand, like how you were basing this, because I saw the positivity rate seemed flat, but like Tony Fauci and all these like feds keep talking about like the second wave is in the fall. And so you said that we were in the second wave at the end of July. So do you worry? I mean, now if like a true second wave in the nature of Fauci and them hits in the fall and we get hammered in October, do you worry that your credibility is going to be, if people are hearing second wave since July, do you think people are going to be less inclined to believe it?
Well, as I said, I called it wrong then. And I think the lesson is that this is very unpredictable. I think everyone would agree that the virus isn't gone and the virus has the potential to come back. And everyone agrees on the basic strategy to prevent that. And so we're going to keep hitting those messages. If the virus case counts go down, that's a good thing. If they go up despite that, that's a bad thing. But I'm going to be more cautious in the future about predicting the future.
Have you been, or do you have any plans to go indoor dining at any Philadelphia restaurants anytime soon?
I do not. It's not. The risk is not worth the benefit. I can get great food by takeout or preparing it at home.
And do you eat outdoors at restaurants or just takeout and pickup?
I don't eat outdoors at restaurants. I think the risk is far lower outdoors, but I just don't see a need to.
Great. And just one other real quick question about restaurants. I don't know if you saw Washington, D.C. has come up with a micro grant program to help restaurants order outdoor heaters so that they're able to stay open safely outdoors into the colder weather. Has there been any talk in Philly of doing anything like that that might help our restaurants survive while providing service safely to their customers?
We have not discussed that. There are thousands of restaurants in Philadelphia. I don't know that we could afford to do that. I would encourage the restaurants that have outdoor dining to keep it open as long as possible and have as many people as possible eat outdoors, because I do think the risk is substantially lower there.
Plus, they're very difficult to come by. My understanding is that the manufacturers are way behind in orders. Ironically, I tried to buy a refrigerator last week, and refrigerators were not available. So there's lots of stuff on the manufacturing end that's behind.
Hi, I have two super quick questions for Dr. Farley. I was wondering, when will you have your next update on whether you'll increase indoor dining capacity to 50% like the rest of the state, just because it is getting colder quite quickly?
Yeah, so sometime next week.
Okay, and my second question is, since indoor dining has been allowed, have you seen any sort of marked increase in cases related to indoor dining at all?
We have not, and we have had our staff going to restaurants both to do education and to do inspections. And what I'm hearing so far is that restaurants have been compliant, and as a rule, not all of them, but overall, we're pretty satisfied with how well they're following the rules.
Okay, that makes sense. And then I have a couple questions for Dr. Farley. As the nation hits 200,000 cases or 200,000 deaths, is this a sign of a national failure to contain the virus? And what do you think that the country should do to prevent, another 100 or 200,000?
I do think that the national leadership on this epidemic has been lacking. I think that they have not been leaders, and their messages have been mixed, and that has really harmed our response in the country. And many people have died as a result of it. I think right now, it needs to be clear that the federal government needs to be clear that the epidemic is still with us, that the epidemic is still deadly, and that there are steps that we can and should all take in order to prevent the spread. The simplest thing is masks. There's absolutely no reason that we should have a political question about whether people should wear masks. It's a very simple thing to do. It could save an awful lot of lives. And I think we need to be committing to do that as we approach what could be a much more difficult season in the winter.
And this is in regards to the possibility of evaluating, given the change in numbers and the change in temperatures, the possibility of loosening up restrictions, especially the 50-person limit in restaurants.
I'd have to turn that over to Dr. Farley. That's a medical and scientific question.
Preferiría que esa respuesta la del Dr. Farley, que es un experto médico y científico. Dr. Farley.
As I said in response to the question, that we will be evaluating our situation now with the falling case counts, and we'll announce next week whether we would go to the 50% limit as the state has.
Will the temperatures be a factor in the evaluation in considering those changes?
I don't think so, no. It's really the likelihood that the evidence of spread elsewhere with the 50% rule and what our case counts are doing.
So it's still just 25 people for maximum for an indoor gathering?
That is the rule at the state level and at the city level right now, correct?
Okay. All right, thank you.
Is really around for Dr. Farley. It seems like there's been a real consistent effort from the CDC internally to tell us the truth. Any comment on the recent taking down of the actual facts that they posted yesterday on your site about how COVID-19 is being spread in areas through, as you talked about, through singing, through breath?
Yeah, so I mean, there is good evidence that political appointees above the CDC have interfered with CDC guidance. And that's very unfortunate because CDC has long been a place where you could go to really feel like you're getting the straight scientific facts. And that's really very, very disappointing. Having said that, what I'm hearing through people who know something about the CDC says that the most recent thing was in fact just an error, that something was posted before it was fully edited and then it was retracted. So in order to be edited, it was more of a process error. The larger point is accurate, though. I'm very concerned about political interference in the CDC. And as far as spread goes, we know that this virus can be spread through respiratory droplets, and I believe that there is increasing evidence that it can be spread to a certain extent airborne, so that it may be able to be spread from more than 6 feet. And that's why wearing masks and ventilation are important.
Thanks so much. I just have one quick follow-up for Dr. Farley. Going back to indoor dining, increasing capacity, if the city were to move to increase capacity, do you know what date that would happen?
I can't tell you now. I said we might consider it in October. I didn't necessarily say October 1st. I know some people will assume it's October 1st. We'll have to just wait till next week when we make an announcement on that.